Good morning and good afternoon. My name is Ellen Lord, Webinar Coordinator for OR Manager. While we allow the audience to get signed in, please take a minute to consult this slide to ensure that you can hear and the slides are advancing through the presentation. All webinars are recorded and made available 48 hours to participants after the live presentation. On behalf of OR Manager, we sincerely thank Cardinal Health for sponsoring this webinar. We deeply appreciate Cardinal Health's contributions to the continuum of patient care and their commitment to healthcare education. Our speaker today is Suzanne Champion. Suzanne Champion is Senior Manager, Clinical Marketing, Pre-Source Products and Services, Cardinal Health. Sue has more than 30 years of clinical experience in the perioperative setting. Since joining Cardinal Health, Sue has consulted on national and international accounts for inventory management, clinical processes and practices, preference card management, and supply chain management. Prior to joining Cardinal Health, Sue gained experience at both teaching in the university setting and at community hospitals. In her clinical management roles, she was responsible for departmental planning, organizational effectiveness, and staff development. She was accountable for driving results that included fiscal and quality improvement activities, OR IT system building and optimization, supply flow efficiencies, cost saving, and inventory reduction. Sue holds a master's degree in business administration with a concentration in corporate finance and a Bachelor of Science degree in nursing. Sue is also a member of ARN, the Association of Perioperative Registered Nurses, and maintains her CNOR, Certified Nurse Operating Room certification. It is my pleasure to turn the program over to Sue.
Thank you, Ellen. Welcome, everyone. My name is Suzanne Champion, and as Ellen said, I am a Senior Clinical Marketing Manager at Cardinal Health. In the next few minutes, we're going to share a new way to solve the challenges of managing supply inventory in the operating room. From my experience, I know how frustrating these challenges can be for you because I really have been there myself. Ellen said I have more than 30 years of clinical experience, and I have seen a wealth of change within the operating room in that time. So I've seen firsthand how difficult OR inventory management can be. With the OR being the biggest area of spend in the hospital, it really is the final frontier, and it allows for us to have a tremendous opportunity to drive more efficiency and cost reduction. Think about it. With all of the supplies that you manage, think about sutures. Commodity item, but a little bit higher priced, and how difficult is it to get your arms around them? They're stored in multiple locations, used across all of the service lines, and you need to be able to manage those. We'll talk about that later. But rest assured, managing inventory in the OR isn't your problem alone. It's everyone's across the healthcare industry, and together we can solve it. To help us get there, I'll begin today with a brief overview of Cardinal Health, then move on to the changing landscape in the OR, the challenges of managing operating room inventory, how to overcome those challenges, and finally, some best practices that you can put to use right away to drive clinical efficiency and to lower costs, while actually improving the quality of care in the operating room. Granted, the challenges are complex, but the answer doesn't have to be. You just have to know where to look and where to start. And together we can do this. So let's get started. I mentioned a minute ago that we understand the challenges of managing OR inventory because we've been there. For the past decade, we've been pooling our experience at Cardinal Health to help you and your peers seek new solutions. Since 2005, we've been creating new technologies to overcome inventory management issues in the OR and throughout the healthcare supply chain. In fact, our total supply chain experience goes back more than 40 years, and Gartner ranks us #1 for transforming the healthcare value chain to meet the new and growing challenges around cost, revenue, and outcomes. You know better than I do that focusing on these improvements has never been more critical. In today's discussion, we'll start and end with the goal of optimal workflows and system connectivity in the OR without compromising what you all do best, which is providing quality patient care. What you see here is a comprehensive OR solution that includes specialty workflows for items such as suture, biological implants, and orthopedic supplies using RFID-enabled technology as the foundation. We'll come back to this later in the presentation, but first, let's take a look at the macro environment to see and understand what's driving the waste that we see in hospitals today. Every year, the healthcare supply chain wastes $5 billion. That's right, you heard me, $5 billion, and that number keeps going up. With the OR being the largest cost center and revenue generator in a hospital, it can also be one of the biggest areas in the hospital that adds to that waste. But that also makes the OR one of the biggest opportunities to start reversing that trend. This is everyone's problem, providers and manufacturers alike. If you think about it, who pays for all of this? And the answer is, we all do. The government, insurance companies, the employees of the facility, but most of all, our patients. That's where it really hits. Think of the difference that $5 billion could make if we redirected it from managing supply chain to managing health care. Wouldn't that be awesome? That's why we're here today. The problem is everywhere, and so is the solution. Together we can solve this, but the time to act is right now. You all know better than I do that you don't have time to waste. We can't just sit back to see what's going to happen because it's happening right now. Everyone can benefit when we start to chip away at that $5 billion. By healing the supply chain, we'll improve efficiency, lower cost, improve clinician and patient satisfaction, but most of all, we will effect quality patient care. So where does the healing begin? Let's take a page out of another industry's playbook to see what we can learn from how they manage supply chain challenges. How do things work in retail? Let's take a look at what happens when you buy a disposable razor at the supermarket. At the checkout counter, you start a chain of data that links the razor you just purchased back to the distributor, actually all the way back to the manufacturer. Then that data might go to a company that monitors consumer purchasing behavior, such as Nielsen. The result is total upstream visibility of your razor from the manufacturer's facility to the point of sale in your hand. The manufacturer now has an advanced set of data to analyze and truly understand what the consumer needs, which makes demand planning more accurate. They can set up production quotas based on real-world data and make just the right amount of product to meet the demand. No more, no less. So there's far less waste and inefficiency, and at the end of the day, that affects the price that you're paying for that razor. There's far less overstock and the hoarding of products. The data tells the razor manufacturer and the retailer exactly how to right-size the inventory levels, which in a nutshell, the data makes it possible to have a more efficient supply chain. If retail industry can do it for a razor, healthcare industry can do it also, but we don't always do it in just that same fashion. And OR supplies can cost many more thousands of dollars than that razor. Just imagine if we had the same level of data granularity for OR supplies. Think about a hip prosthesis. How would that impact the efficiency of managing that prosthesis? As you know, a hip prosthesis can cost up to $18,000 and sometimes even more. And that's a far cry from that razor that costs less than the favorite latte you maybe got at Starbucks today. And unlike the razor manufacturer, there is no data capture and connectivity from the point of care back to the manufacturer. Basically, no upstream visibility. No real-world data analytics to help you understand the demand planning. Hips aren't the only product with this problem. It affects all of our high-cost items such as implants and tissue, but it also affects our commodity items also. You need to manage those as well as the high-priced items. But it's not that we're completely blind out there. The healthcare supply chain has done a very good job and has very good data on purchases from the manufacturer to the distributor and to the provider's door. We do know what was shipped, what was bought, and what was eventually used to care for a patient. But that's typically where it stops. We don't have any data about the next critical moment, which is the actual use of the product at the point of care. Go back to the razor example. We know that that razor was bought, but we don't know anything about what happened at the checkout counter. So we're missing the most important data of all, the data that can also help providers make more informed and therefore better purchasing decisions. This visibility can improve OR supply purchasing for not only individual hospitals, but also the entire system across an IDN. But make no mistake, hospital ORs need to make better purchasing decisions. We understand, but the challenge isn't new. I'm not telling you anything you don't already do every day in your life in the operating room or within the supply chain for a hospital. The healthcare industry has been working hard to drive down costs for years. And in the past, if you think about it and remember back, labor was typically the first place we'd look to try to save money. That's your biggest bucket of costs going out every day is your labor. But with healthcare reform and an aging population, it's driven all of us to look beyond labor for new savings. You can't just keep cutting people. An obvious target really is supply costs. After all, materials make up over 35% of hospital expenses, and that number continues to grow. Does that sound familiar? Think about space in your OR. Supplies are coming in all the time, and you run out of even space for them. So it's a strong opportunity for cost reduction. Today, we know there's tremendous pressure to reduce product costs as declining reimbursements threaten the revenues and also the profits for the operating room. So in response, many manufacturers have begun to commoditize their products to meet the provider demands for lower prices. I can tell you from my own hospital experience that we're at a point now where there's little wiggle room left for many of those products to have the cost lowered. Think about it. Eye implants for cataracts, even bundled charges for orthopedics for the implants. We have hounded the manufacturers for years to get those costs down. I don't know that there's really much room left to drive them even more. So where do you look? Because you're still being charged with get that budget down. Reduce your budget by not just hundreds of dollars or even thousands, but by millions. So that leaves you with a supply chain to look towards as a source of savings. What could the potential savings be in the OR? Well, let's take a look and see. It turns out the savings really could be quite a lot. The biggest consumer of supplies in a hospital are your procedural areas, in particular the operating room. Other than labor, it's typically the biggest budget line in a hospital. ORs are responsible for an estimated 40 to 60% of a hospital's total supply cost. It sounds crazy when you see it on paper, but if you think about the supplies in your OR, you're probably sitting there nodding your heads. That's $850,000 to $1 million per surgical suite every year. The average inventory per suite is between $100,000 to $120,000, with an annual inventory turn of just 4.8. For you materials managers and supply chain people, you know that turn is far too low. On the other hand, the average amount of time the OR staff spends on inventory management is far too high, many times as much as 25%. Don't you think that the clinical time could be put to better use focusing on patient care and taking them away from the supply chain management responsibility? Within all of this, because of the practices and the variety and the variance that we have between practitioners, ORs sometimes don't necessarily always waste time, but also supplies as well. In fact, the OR is one of the largest producers of waste in the hospital, generating between 20 to 30% of that $5 billion total that we talked about. That is just astounding to me. So what can we do together to start reversing this trend? Well, I think it begins by recognizing the barriers that stand in our way to change. You'll see here at least 10 barriers that prevent us from more effectively managing the OR inventory. And I know for every one of you out there right now, you could probably add another 10 to the challenges that you deal with every day. I know you live these challenges every day, and you are always trying to find ways to work around them. How do you overcome them? How do you improve efficiency and reduce cost while maintaining that quality patient care? And think about it. Whose responsibility is it? OR directors, OR managers, the supply chain managers, the clinicians, the physicians? The responsibility varies from hospital to hospital, and many times it's that gray area, especially when OR inventory systems, so many times they're changed without staff input and without truly understanding that OR workflow. I don't have to tell you that the OR workflow is a complex beast that it takes horrendous time to try to manage. Think about all of the service lines that feed into that total OR inventory supply chain. You have cardiac, you have orthopedic, you have vascular, now you have the robotics line. All of those feed into that supply chain, and it just grows and grows. But that's just the beginning of what makes OR inventory such a challenge. There are many more challenges: the diversity of procedures. Procedures can change every day. Think of the technology. It seems like every week there's something new out there. There's a new procedure to go with the technology, and of course there's always supplies that need to go to support that technology and the procedure. So what do? And then, not only that, and those are the high-ticket items, think about the multiple categories of commodities that are stocked in your OR. They're a growing target for providers faced with relentless pressure to lower cost. It really is a rich opportunity for standardization. Now that we've discussed some of the barriers, and we know it's a challenge to overcome them, and as a clinician, I know it's easier said than done. We'll talk more about how to address these later on, but here are some common challenges that I've experienced. There can be an overlap in roles and priorities of your stakeholders. So if you think about the stakeholders, it's materials managers, it's the OR directors and managers, it's the clinicians. Everybody has a say and a stake in how well the facility runs. You have challenges in communicating key business information across cross-functional teams. Many times it's difficult to keep that communication flowing both ways, up and down. You have difficulty gaining buy-in when there's a change. You know, especially for the clinicians, they're there to provide the care, to get the procedures done, to assist the physician. And if you change things up on them and it puts a a change in their process and how they do things, they're going to push back because they need to do it efficiently and effectively, they know at the end of the day. There's learning curves, and many times we don't take that into account when we're changing processes. And sometimes if the clinician's not comfortable with the workflow, they'll figure out a way to work around it. We all know that OR nurses are the original MacGyvers. If they don't fit into their practice and what they're doing and how comfortable they are in doing it, they will find a way to work around it. Think about your secured cabinet doors that you have for some of your high-end items, or maybe you have commodity items in those cabinets. How many times do you look and you see that there's been a workaround and those doors are open? So now that we know the stakeholders and the challenges, let's talk about the priorities. If you look at these priorities for supply chain manager, the OR director, the OR manager, and the clinician, you'll see every box is checked. They are all aligned. At the end of the day, we all do have the same priority, and that's to provide quality patient care to our community. But what is different is that everybody in those priorities has a different focus. So the supply chain manager may put more focus on areas such as product visibility and eliminating waste. You have the clinician who, at the end of the day, their focus is patient care. And what they need to do is to have the product when they need it, and then to document any of the regulatory concerns that go along with that for the implants. But everybody's working towards the same goal. For example, if I'm focusing on patient care, I do still need visibility to the product. It's very important that it's there when I need it. And if it's not, that's when you get into that MacGyver, or you also have hoarding. How many OR people out there know that you have alternate stocking locations based on your nurses? It can be the pocket of their scrubs. It can be their locker, or it can be that little cubby hole that's down the hall because one time your clinician went to get that product and it wasn't there, and they will never let it happen again. So we need to figure out ways to help reduce that so that you have a better understanding of your supply chain. So when you think about it, let's see how the clinician can be impacted by the supply chain. Nurses currently have to split their time between inventory management and patient care. I don't know how many times throughout my career I would just stand there and say, I am not a materials manager. That's not what I went to school for. I am here to be an advocate for the patient, to assist the physician, and to get that surgery done. It's my job to be their eyes and ears. Yet it's not unusual for nurses to have to take on the responsibility of inventory management. They're tasked with decrementing inventory, performing cycle counts, ordering supplies, inspecting the stocking locations, straightening up the stocking locations, you name it, many times they have to do it. That takes a lot of time, and it generates a lot of frustration for that clinical staff. Is this really the best way to leverage their skills and knowledge? They are typically your highest paid people in the facility. Do you really want to use those folks to do supply chain management functions? When nurses are spending their time working on supply chain tasks, it takes away from what they should be focusing on, which is the patient, which leads to frustration and dissatisfaction, and not only for your staff, but for the customer as well, for that patient. Do you think patients don't see their clinicians focusing on products and supply chain? They have eyes and ears too. What OR nurses should be doing is documenting the implant. You have to document it, and you really do need to adhere to regulatory requirements. But even those essential tasks many times are manual and inefficient, and they waste time and create the opportunity for human error. There has to be a better way to manage the inventory and the documentation tasks. So let's focus on a key area that's ripe for improvement. What happens when products are logged and reordered in the OR using a current manual process? Even if you have an OR IT system, many times that documentation entry is still a manual process. As you can see here, there can be numerous steps in the manual process. And from opening the supply in the room, to charging the supply, to documenting the supply, and to completing the implant log for reconciliation. Think about mesh and how it's grown through the years. There's multiple types, there's multiple sizes, there's physician preference, patient-specific, and all of that has to be documented. And things like that, it can be on the preference card. And if you have an accurate preference card, then a lot of times it's charge by exception or document by exception, so the nurse can select and charge for the items that are on the card, or say that you didn't use it, and that makes it really great and easy. But every time you do it for anything else that's not on that card, it is a manual process, and it can take up to a minute per item. And every time there's another item that's opened that wasn't on the card, that step needs to be repeated. That just opens the door for the potential for documentation errors. And every time there's an error, it does need to be reconciled. And many times you do need to pull the clinician back into it, and it can take as much as 15 minutes to correct that error. Once again, you're just feeding into the frustration of your clinical staff. Now compare that to what an automated system can do for inventory management. Those steps suddenly can be reduced to just a couple. The OR nurse can take the product at the point of use using either barcode or RFID technology, depending on what's appropriate for the product. The products, because of that automation, are automatically logged and recorded, and your charges and your use are captured. How much time does the nurse spend doing this automated, sophisticated technique? Not minutes per product, but just seconds. In fact, just 5 seconds or less. Does that sound enticing? Let's talk about how you can get started. Let's talk about our strategy and where to begin. First, go back to think about that slide about the priorities for the people, the stakeholders, supply chain managers, the OR manager, the director, the clinician. The priorities are all aligned. And from the surface, it appears connecting the problems of inventory management is close to impossible. But if you dig down into it and get down to the priorities and what we all need to be doing, it is possible and it can be done. If you ask any CEO what their biggest expense worry is, chances are they'll say the operating room. Remember, the OR is 40 to 60% of all supplies used within a facility. To solve the problem, we have to start by building a stronger shared vision between the OR and supply chain. As you build a stronger vision and a shared experience between the two, you help to build up the trust that you truly need between these two entities. The goal is to agree on that vision and to work towards a reality. How do you make supplies run more efficiently through the OR? Everyone owns a piece of this puzzle, but everybody sees it a different way. The business managers see the challenge one way, supply chain sees it another, and the OR director can have a totally different vision of how they see their operating room functioning. It really is too big of a challenge for any one stakeholder because the problem is ingrained across everyone. It impacts clinical, operational, and finance, all at the same time. But if you all work together, we can leverage the supply chain to begin solving that problem. We can reduce write-offs, optimize par levels, and improve clinical workflow. You can do this. I know it sounds overwhelming. It almost sounds like something you don't even want to get started on because where do you start? But the cure is knowing what steps to take, starting with the first one. For you clinical people out there, put on your Nursing 101 hats and remember the nursing process. And what is the first thing that you always have to do? you need to assess where you are. You can't make any decisions or even have a vision of where you want to go if you don't know where you are right now. So how do you do that? How do you do an assessment? Do a walkthrough of your supply chain and include all of the stakeholders. Walk together and think of a lap sponge, a package of lap sponges. Follow the life of a lap sponge through the supply chain, from the time it comes to your dock at the inventory level until it's actually opened at the point of use for a surgery. Once you do that, sit down and discuss what you saw. Look at everybody's vision for what they saw and where they see it going, and how does that all align with your overall priority. Now, how do you take these steps and make it a reality using automation? There are several best practices out there. One includes RFID technology, and that's typically good for your high-value products such as implants. There are many advantages because it helps you in eliminating the possibility of implanting an expired product. It helps you to quickly locate recalled products. It allows for easy access for clinicians, and it is very intuitive. Just take the product and go. That's what the nurse has to do with it. If it's not used, put it back on the shelf. Because the product's location is tracked automatically, you always know where it is. If another department borrows it, and we know that happens quite often, many times after hours, you're going to know it. And if it's not on the shelf, but it hasn't been charged to a patient, you can find it. And this solution with RFID is scalable, which allows you to start small, and then as you build your case for technology and it really fits into your workflows and your processes, it can grow as your needs change within the department, and then it can expand out to the hospital and even across your IDN. Another technology is the two-bin Kanban system, which has great use for the commodity items. If you think about it, you want to always make sure in those commodity items that the first in is the first out, that you use the oldest product first, so that you're not having to worry about expiration dates and things outdating or being shoved back into the cabinet, and then they get, the sterility gets impacted and then you have to waste it. In this case with the Kanban, the supply chain team are the people that can take over the management of the inventory and making sure that stock gets rotated. There's really no need to check for expired product. Clinicians can take the product and go. You can use this also many times when you have clinicians in the supply chain. Their idea of par levels are much different than a supply chain manager. Most of the time, clinicians will fill to capacity the space that they have. If the capacity would hold 100 packages, that's what you're going to see a nurse putting in there, because we're always prepared for that what-if scenario. So the Kanban system helps to reduce that, because the bins are a certain level and materials management knows what that par level should be. Once you get your arms around this and you're using technology, it gives you better data for accurate cost and charge capture. It replaces a lot of the manual processes that you have with automated steps that take seconds to complete. And it really is important to be able to do that cost capture. Charge capture maybe is not as important as what it was because of the way we are reimbursed today, but you still need to know the cost capture. How do you determine what your cost per procedures are if you don't know what all supplies that impact that procedure, what they total up to? And if you can do it automatically with automation and not have to do the manual processes, you really will improve compliance on that. If you make it easy for the clinicians, they'll comply to what the process is, and they're not going to find workarounds. Automation can help you lean into your OR IT system and take what's great in your IT system that you have and pull that documentation together with what you can get from the technology for supply chain management, and you will have a wealth of knowledge. It reduces some of the manual counts and the cycle counting, and there's always errors. If you have a person having to count how many widgets are on your shelf, invariably there will be errors in that. And it reduces the time spent reconciling the inventory and what you're doing with it. Most importantly, though, are the strong analytics that provide accurate real-time data. If you have this data, you can collaborate with supply chain to really set inventory levels based on a more predictable ordering pattern. You can use this data to analyze and improve your OR functions, establish that cost per procedure best practice, and that inherently leads into the ability for you to be able to standardize where it makes sense. It can help you clean up preference cards because that added technology, that added data that you have can help you understand that it's on your card but it's not used, so maybe you need to revisit your cards. Now let's take a look at how all of these tools can come together to form a total inventory management system. Our approach is, first, the system has to address the sheer scope and complexity of your OR supplies, and you have to have the right inventory tool for the right product. It doesn't make any sense to have a very sophisticated tool if it's not meeting your needs, or sometimes it's overkill. Think about when I said before, those locked cabinets that you may have and nurses find a workaround because it just takes too much time to enter in all the data to get a commodity item. You want to make sure that doesn't happen with the automation that you're putting in place. And I know it sounds simple, and it really is, but the right inventory management system is built on a foundation of complex supply chain science based on lean methodologies and Six Sigma controls that eliminate the process variations. Now that was quite a mouthful for me, and I honestly, it's good technology, it gives you great data, but at the end of the day, what you need to know is that there are options out there to help you manage your supply chain. RFID for your more expensive high dollar items, your implants, and a Kanban system that allows you to get your arms around those commodity items, which the commodities, they lend themselves to about 80% of the supplies in your OR, but really only about 20% of your spend. Yet think about how much time you're spending on those commodities trying to manage them. A Kanban system will help to reduce the time that's needed. The right system, when you put it in place, really is a proactive system versus reactive, so that it can improve efficiency and drive down costs, all the while freeing up that clinical time so that they are dedicated to the patient. The right system also is scalable, and it connects the supply chain from end to end, from the manufacturer to the point of care. It automatically collects actionable data about your product consumption and utilization by your physicians, and so then it helps you optimize your inventory spend. Above all, it gives you a level of control that you've never had before. Seriously, I have implemented solutions at hospitals where they may say they have 17 days of inventory on hand. On the surface, that doesn't sound too bad. It sounds pretty good. But when you actually start digging into their inventory, you see that they may have 70 days of those items that are rarely used and only 2 days of what's critically needed. But if you add the right upstream visibility of the right inventory management program, that problem can go away. You can't manage what you can't see, and you can't budget what you can't manage, and you can't standardize what you haven't budgeted for. It all flows into one, and it all drives you to those best practices that allow you to provide that quality patient care. So if you look to automate and manage your inventory, it does make you more efficient, and it allows you to see it all from beginning to end. So how do you roll these best practices into a specific workflow? How do we address the challenges that you have in inventory management? Let's take suture and walk through 2 scenarios using automation on how you can manage the suture within your OR. I said there are two options, and the first one I'm going to speak about is the use of RFID technology. The technology is based on the needs within the hospital, as I said before. What works best for you? All solutions are designed to accommodate the variety of suture that you have on hand, and it includes those physician preference sutures. But the greatest thing is it provides visibility to the usage of this critical item. So with RFID technology, it can be a simple four-step process. Materials management would register the suture box as it's received, and it adds an RFID tag. The suture box is then placed into inventory, and you can gather usage reports that are now pushed to a cloud-based analytic platform. The data is gathered by performing cycle counts using an RFID-enabled smart wand, which provides insight on key data, including consumption and par level. Materials management, they're in charge of replenishing all of the stocking locations, the suture trees, the room stock, the case pick area, wherever it is that you're storing suture. And materials management also continues to manage the inventory through the advanced analytics and smart ordering based off the par levels. This allows for real-time visibility across all of your locations, no matter how many you have. And it allows the supply chain people to have a fast, efficient inventory management using that smart wand. So RFID will work for suture, but there's also another option. Let's take a look at the two-bin Kanban system. Once again, I really do want to reiterate that it's based on what your need works best for your supply chain. One is not better over the other, it's what meets your needs. The Kanban process ensures that first in, first out that I talked about before. It eliminates the manual cycle counts, and it simplifies suture return. I don't know about you, but suture that was pulled and not used and needs to go back into the supply chain, it was the bane of my existence when I was in the operating room. Hundreds of packs a day. So how do you handle it? It really is difficult to get your arms around that one, and the Kanban can help. So the Kanban is set up so that there's a front and a back bin, and the front bin is where the nurse would pick the suture from first. And if you pick the box of suture from the front bin and it's the last box, the empty bin gets set up so that materials management can address it later. Unused sutures, though, this is where it comes into play. Those unused, unopened sutures go back to the Kanban, and there's a compartment in the front that allows those unused sutures to sit there, which alerts the clinician to pull those first when they're pulling for the next procedure rather than taking out of the box. And if the bins have been placed on the top shelf as a signal for materials management for replenishment, then materials takes it, collects the empty bin, scans for reorder, and replaces the refilled bin in the back when complete. It takes away the anecdotal, I'm going to fill to capacity. I know I had nurses that would shove the sutures back into the box and it would be overflowing, and if you did a count, instead of 36 in that box, there would be 52. How did that happen? That's because they were putting it back in. And how do you really regulate and control lot numbers and that type of thing? So we've looked at suture. It's a workflow that's simple but complex at the same time. So how does this process grow and help to complete automated inventory management throughout your operating room? So you take best practices and you put it into an effective model for inventory management in the OR. As you heard me say earlier in our presentation, RFID is one approach and it can be the foundation. This is the model we use at Cardinal Health Inventory Management Solutions. As mentioned earlier, the solution has to be scalable to meet your needs. Our solution is designed with the ability to start small within a specific area, such as that suture that we talked about, and to grow from there as you build the case for technology within your facility. We created the solution to meet the challenges that we know you're facing today, because ultimately there are challenges too. We need to help you overcome the greatest cost pressures any of us have ever seen in our careers. I think back to the mid-'80s when DRGs first came into play, and I thought we would never see anything like that again. Total change in reimbursement, how we were paid for the work that we did, and now with the Affordable Care Act, I am seeing changes again that I never even thought possible. You have to, it is mandatory, it is just so critical to move the inventory responsibility away from the OR nurse and get them into the hand and get them to focus on patient care. With the Affordable Care Act and reimbursement, you are now receiving reimbursement based on the satisfaction surveys and how you perform based on those surveys. If the patient sees that their nurses aren't focusing on them because they're dealing with supplies and other issues in the OR, what does that do to those satisfaction surveys? We need to do something to get nurses out of that realm. We really do need to replace manual and inefficient processes with leading-edge automation. It's happening everywhere else, and it needs to happen in healthcare also. We need to eliminate waste and errors, and we always are striving to do that. That is something that's not new. But automation, most importantly, provides a wealth of data analytics that reveal what actually happens at the point of care, so it improves utilization and purchasing, but it also improves your ability to manage your facilities, to budget for what you need, and to make sure that you do have it in the correct places, that your focus is where it should be. This is the future for automating inventory management, but there's no need to wait because it's happening right now. And here at Cardinal Health, we can help you get to where you need to be. Thank you all again for your time and your attention today. I would be happy to answer any questions that you have.
Thank you, Sue. We do have some questions for you. First question is, does this solution expand beyond the operating room?
Oh, most definitely. This can expand to anywhere within your facility where you are storing and managing supplies. Remember in the presentation I said that this is scalable. You can start small. You don't have to implement it totally throughout the entire facility. You can start with one area, see how it works, build your case for that technology as you move forward.
Another question is, can your solution only be used with Cardinal Health products?
No, not at all. Actually, our solution is vendor neutral. What we're doing is an adjunct to the systems that are already there within a facility. It supports your materials management systems, your PeopleSoft, your Lawson. It interfaces with the ORIT systems, the Cerners, the Epics. We are able to take all of that information, merge it with the data analytics that you get from our automation, and it gives you a stronger base for your decision making.
I have an automated inventory management system already established in my operating room. How easy is it to switch over to a new system?
It can be done, but first you always need, as I said, like the nursing process, you need to do an assessment. We need to see what you're doing, how it's functioning for you, and where you would like to be. We need to understand your vision. Most of the time, a phased approach can be supported. It's not one of those you take it all out and put something new in. We can work with what you have, and once I said, it's scalable. You can make it work from a small scale and continue to move on as you see the improvement it's driving in your supply chain and the ROI that you're getting back from that. Then you move on to bigger and better things.
You mentioned one of the best practices is to have a strong analytics platform. Can you go into more detail about what can be achieved with real-time data?
Having real-time data allows you to manage your inventory and have better demand planning. It honestly takes away that anecdotal, well, I think this is how much I need, and it gives you true scientific data behind it to say, this is what your demand is based on your consumers, your physicians, your OR personnel, so these are the PAR levels that you need. It gives you better visibility into that product usage. You know it's used many times just based on the op record, but if you want to know more, the analytics can give that to you. It gives you a granular detail by procedure with the analytic component. It allows for better PAR level management because maybe the PAR levels that were set aren't supporting what you need, or maybe they're higher than what you really need. Your practice has changed, the demand has changed. It helps you keep on top of that. It is science driving it instead of emotion. And also, as I said before, the charger cost capture. It allows better integration so that you can understand what your cost per procedures are. It allows you to bump that up against what you're getting from these analytics with your pick list information, with your IT OR system information, with the Joint Commission requirements, with all of these different systems that feed to you and give you data. It helps you bring it all together to make better decisions based on the analytics so that you're budgeting and working your program the way it should be.
Sue, we struggle with managing physician preference items. What suggestions do you have for getting this under control?
That's a great question. There's probably not one of you out there that doesn't struggle with this. How do you get your arms around the physician preference items? Those are the ones that probably lead right into those challenges that we discussed. And standardization, that's the buzz term in the industry right now. Everybody is looking to standardization because they know if you have standardized practices, it drives to efficiency and to cost management. To be honest, the term physician preference item, it's probably going away. Nobody wants to hear that anymore. It really is all about standardization. But you can only manage things that you can see, that you have visibility over. So how do you get around that? Technology can help address it as it helps you to manage, keep costs low, and still maintaining the quality patient care. You use these analytics to make better decisions. You know, you can use these analytics to sit down with your physicians because many times with the physicians, if you have hard data to show them what their practice is doing to the supply chain and how they compare to other physicians and surgeons within their specialty, it allows for better communication and better talk between you and your physicians. It helps to break down some of those walls and the barriers. If the data is black and white, they'll be more likely to listen to you. I'm not saying it's the magic wand, but it certainly is a great start in helping to have those conversations with your physicians.
And I understand that preference card management, Sue, could be a discussion in and of itself, but can you discuss how effective preference card management can link to better inventory management?
Yeah. I'm chuckling a little bit with that question because really, preference cards, oh my goodness, are they a beast. But if you think about it, the preference card is the engine that drives the chain. It drives the supply chain. Everything on that card needs to be available so that your case pick people can put it onto the case cart. Your clinicians are looking for it because they know that they need to open it for the procedure. So that drives your purchasing behavior. And if the preference cards aren't accurate, they increase the waste and the time spent by the staff. Think about it. Inaccurate card, there's items on that card that are on there but you really don't need. Maybe they're not designated as a have available, so they're opened. And if they're opened, what do you do with them at the end of the case, even if you didn't use it? You throw it away. Or many times all it does is skew your inventory because it's always on a case card and not on the shelf. So when you're reconciling your inventory, it's not there to be counted, either automatically or manually. So then you don't know what your true inventory is. So preference card management and how it can link better to inventory management. When you use the technology, it allows you to have hard data on the consumption. So then you can even speak with your nurses and talk about maybe we need to revise those preference cards and make them reflect what we truly see. That doesn't mean that you don't allow for the what-if scenarios, but it really does help you to better manage those cards.
Thank you, Sue. Last question is that I am using barcoding technology to manage my inventory. How does this technology compare to your approach to inventory management?
Okay. With barcoding, it really is line-of-sight management. You have to scan every product. You have to touch every product. You need to find the barcode on that product so that you can scan it. And if any of you have ever looked at the barcodes on a box or a package, sometimes there's 2 or 3 barcodes. So which one do you use? Which one is the barcode that's tied to your inventory system? And it's still manual. You need to touch every item when you're barcoding. But with the RFID technology, it allows you to capture things at a unique level, and it's a one-stop shop. You can you can manage and monitor items 50 per minute, and that way it's not a manual count. You can use the smart wand to go over the items and to really be able to track it without a lot of the manual processes. So it really reduces the labor and the opportunity for error. As I said before, anytime you have to interject the human piece of it, there's the potential for error. People don't try to make mistakes. That's not their goal. They work very hard to be good at their jobs, but it's just human when you're dealing with hundreds of supplies a day that errors will occur. So RFID helps to eliminate that.
Thank you, Sue. You have provided us with an excellent and informative presentation today. Again, OR Manager greatly appreciates Cardinal Health's sponsorship of today's webinar and their support of nursing continuing education. Without support like yours, nursing education has a great deal of void in their need for excellence. Our final concluding slide will show you how to receive your continuing education credit information. Please be advised that only those who have actually registered for the continuing education credit for this session will be issued only in the name of that person. The on-demand version of this webinar will be available 48 hours after the live webinar, which can be purchased for additional CE credit. Thank you again, Sue, for your excellent presentation, and to Cardinal Health for their sponsorship of this event. Our next webinar will be on the 30th of the month, and it will be on optimizing processes in the OR. Again, have a good day, and this concludes our webinar.